Our presentation topic is on peptic ulcer disease. This presentation is brought to you by Jetty, Ben, Autumn, Esmeralda, and Crystal. So what is peptic ulcer disease? So this is the development of a sore or lesion, also known as an ulcer, in the mucosal membrane of the lower esophagus, stomach, duodenum, or jejunum. There are two major forms of peptic ulcers. Duodenal ulcers account for 80%, and gastric ulcers that occurs in the stomach lining. Some causes of peptic ulcers. Most common causes are infection with the germ Helicobacter pylori, also known as H. pylori. H. pylori is an infection of a germ that spreads through contact. So you can interact with this germ through bodily fluids, with saliva, vomit, or stool, poor hand hygiene, tainted food or water. H. pylori can cause low-level inflammation, stomach pain, bloating, gas, and other symptoms. Although some people may live with this bacteria, 80% of the population does, many people can develop peptic ulcers in the lining of the stomach or the small intestine.
So some more causes of peptic ulcers include long-term use of non-steroidal anti-inflammatory drugs, including ibuprofen, Advil, Motrin, IB, and Aleve. Drinking too much alcohol, smoking or chewing tobacco, stress, and familial tendencies. It is a common belief that spicy foods cause peptic ulcers. However, they do not cause ulcers, they can exacerbate the symptoms. Some signs and symptoms are dull or burning stomach pain. This pain may worsen after meals or at night, depending on where the ulcer is located. Feeling of fullness or bloating, belching, heartburn, nausea. Some signs and symptoms of that the ulcer is bleeding is vomiting blood. It may appear red or black or tarry stools, and then feeling dizzy or fainting. The most affected population of peptic ulcer disease are people over the age of 60, and men also have a higher risk than women. So what causes exacerbation of peptic ulcer disease? Diseases that cause an increase in HCl production, including Zollinger-Ellison syndrome, cystic fibrosis, and hyperparathyroidism. Food and drinks that are fatty, spicy, acidic, or include caffeine, they also increase HCl production. Excess alcohol use or smoking, age 65 or older, physiological and psychological stress, and then medications such as NSAIDs, corticosteroids, biphosphonates, potassium chloride, and fluorouracil.
So next we will go over some nursing management. The first is some diagnostics. So imaging would be barium swallow test or upper GI and small bowel series. This may reveal the ulcer. Upper GI x-rays reveal mucosal abnormalities. Some diagnostic procedures. Upper GI endoscopy confirms the ulcer, identifies H. pylori, and controls bleeding. Labs would be a breath test. A positive breath test would be an indication of H. pylori. Gastric level test would be to rule out ZES. Nursing assessments would be identify pain, what makes it worse and what makes it better. Is there a pattern to the pain? Is it before or after meals? Any history of vomiting? What does it look like and what color? Is there any blood in the stool? If so, is it constant and what is the quality of it? We would ask the patient to keep a 72-hour food log, as well as ask if they have any habits of smoking, consumption of alcohol, or use of NSAIDs. And then we would also ask for any family history of peptic ulcers. Nursing diagnostics would be acute pain, anxiety, impaired nutrition, and deficit knowledge. Nursing interventions would be relieve pain by treating with prescribed medications, reduce anxiety, So assess and identify levels of anxiety, interact in a calm and relaxed manner, explain all procedures and treatments, identify stressors that increase anxiety, and provide coping and relaxation mechanisms. We would provide education on medication, dietary restrictions, and lifestyle changes, and monitoring and managing potential complications.
So next is pharmacological interventions. So what you want to do is eradicate H. pylori and manage gastric acid. You can do that by doing a triple therapy with 2 antibiotic and 1 proton pump inhibitor. Or you can do a quadruple therapy, which includes 2 antibiotic, a proton pump inhibitor, and a bismuth salt. You can also add H2 blockers and proton pump inhibitors can be prescribed to reduce gastric acid not associated with H. pylori. Patients should complete all antibiotic medication regimes. They should avoid NSAIDs and they should stop smoking. For diet, patients want to avoid extreme temperature in food and beverages, avoid alcohol, avoid coffee, including decaffeinated coffees, avoid caffeinated beverages, and encourage the patient to eat 3 times a day in small quantities to neutralize the acid. Monitor and manage potential complications. The most common complication is hemorrhage. So this can occur with vomiting or in the stool. The vomitings can appear bright red or has a dark coffee ground appearance. Large amounts of vomit loss greater than 3,000 ml requires immediate intervention to prevent hemorrhagic shock. Blood in stool can appear black or brown. Some signs and symptoms that may accompany hemorrhage is fainting or dizziness, nausea, increased heart rate, increased respiratory rate, and low blood pressure.
Other ways we can manage our complications. So one common complication that can occur if left untreated is perforation of the ulcer, and that's an emergency. Perforation would create a hole in the stomach or peritoneal cavity. And perforation can occur without warning and can lead to sepsis. So it's very important that we get this treated immediately. Signs and symptoms can include sudden and severe abdominal pain, vomiting, increased heart rate, or low blood pressure. And we also can have gastric outlet obstruction, and that can occur when the lower part of the pyloric sphincter becomes narrowed and scarred from spasm and swelling, and that can then break down. And some signs and symptoms of gastric outlet obstruction include constipation, vomiting, and weight loss. So it's just some follow-up interventions here. We as nurses should educate our patient to avoid any medications or food that can increase the signs and symptoms of peptic ulcer disease, and provide education about how smoking negatively affects our health and can increase the risk for peptic ulcer disease. And then also just so we provide education so we understand what our signs and symptoms are, and that we can contact our primary care physician if we do have signs and symptoms of peptic ulcer disease. So some community resources that are available around here. We have Valley Registered Dietitian Network. We also have San Joaquin County Public Health Services, and also CalFresh as well. And that would conclude our presentation here on peptic ulcer disease.